Hi all, we just want to talk real quick about NG tube placement and correct use of the anti-reflux valve on the NG tubes, because we have had a lot of questions about these and continue to have issues with these being hooked up incorrectly. So first off, I want to remind you all that if you see blue, think sky, air. The only thing that can go in here is air in the blue port, okay? The new NGs that we have that just come like this and are coming with one of these anti-reflux valves already in place. This is how the NG just came out of the package, just like this. The valve is here. You also now have this nice tapered connector for your suction tubing. After the NG has been placed, you do need to put air into the air blue valve. On the new ones that come like this, you do need to use a lure lock. You want to put 10 to 20 mils of air in there. When you do this, you can also check placement like this at this time. Sometimes if you do a lure lock and 10 mils, it may not be enough to hear placement, but you can try. But you want to at least put 10 mils of air in there. That's a manufacturer's recommendation. When I used to place NGs all the time, we did this on a regular basis. If you cannot hear placement with that, you do need to get a Toomey syringe, and you will need to take this part out, put it in the regular part, the regular clear part, and instill enough air so you can hear placement. Once you confirm placement and you have put air, you need to put air, at least 10 mils, into the blue port. The blue port, again, only for air. If you're going to hook up to suction, the new ones, like I said, come with that in place. You want to then take your suction, hook your suction up to the tapered connector, and obviously then hook this to your suction canister. You can get rid of this. This does not, the one that comes on the suction tubing, y'all, does not really fit into the NG tube. So if we do have more of these, very similar, not exactly the same. We have more of these in the supply cabinet. If you need to get that, if yours doesn't have it, or if you lose it, you can replace that, so it will connect to your suction. Also, I want to let y'all know, if you go in there and the patient's had an NG for a couple days and you're not getting any gastric contents out, you're having trouble with suction, one of the first steps that you can take, instead of trying to flush with water, is you can go in there and instill another 10 mils of air in there. It should hopefully start allowing you to suction. Sometimes this gets up against the wall in the stomach and you will not be able to get gastric contents. Sometimes just instilling a little bit of air in there like that is enough to start allowing you to have gastric contents flow back out to suction. Okay. Next thing I want to let y'all know too, some of them, these are the new ones that we have, literally got it out today, of the clean utility. The old ones do not come with the anti-reflux valve in place. So then you will need to get a new anti-reflux valve. Blue goes to blue. Blue goes to blue. You will still need, and at this point you will need to get, this does not have lure lock obviously, and this you cannot hook any kind of syringe to. You will need to get your Toomey syringe. You need to put in here and instill 10 to 20 mils of air in there after it is placed. Then when you're done instilling the air, hook it blue to blue, and there you have it. Your anti-reflux valve is in place.